This is Charlotte Talks. I'm Mike Collins. Once a month, Mayor Vi Lyles is on the program, and she's back today and joined this time by Chief Robert Graham, Deputy Director of Charlotte-Mecklenburg Emergency Management. Just as COVID-19 has changed everything about your world, so too has it altered the business of the city. So we'll spend the hour talking about how the city is working to respond to the outbreak, what plans they have to help small businesses survive this pandemic and the forced closures. And with stay-at-home orders in place, what is the city doing for those who have no homes to stay at, the homeless? And that just scratches the surface. So let's get to it with Mayor Vi Lyles and Chief Robert Graham. Thank you both for joining us this morning. Good morning. Welcome.
Good morning, Mike, and good morning to your listeners.
Morning, Chief Graham.
Good morning, Mike, on a beautiful day in Charlotte, North Carolina.
Well, it is, and maybe what we're about to make it better, because Mayor Lyles, you have something to announce this morning, something called the Community Recovery Task Force. You're already looking ahead to the end of this pandemic and what happens next. What is this task force all about?
Well, if you know, we had a council meeting, a virtual council meeting, following all of the guidelines on Monday. And the council was passionate about what do we need to do as we think about the economy of our city and what happens. And I have to give a lot of credit to the council and Mayor Pro Tem Julie Eiselt, because we worked really hard to develop a plan that we think is realistic and ready to go. So we're going to create a community recovery task force. And that task force will focus on three business sectors in our community that impact not just businesses, but all of our residents. And we're going to work to develop ideas and plans for how we look forward to the recovery. When this pandemic is over, how do we make sure that we can get our community back? I've been reading other cities are doing this, but Julie Eiselt read a lot about it, and we put it together as a result of those discussions. We're going to focus on small businesses, housing for our residents. And we look at the airport as an economic engine, and basically it's like a small city. And we're going to look at our airport to see what's necessary for us to come back. So we're just going to look at post-recovery and think about what are the things that we need to do, the challenges that we're facing now, and how we can determine what we need to do differently. The unique thing about this task force is we're going to have council members on each task force, but we're going to invite community thought leaders in each sector to join us. The meetings will start immediately. We're working right now to populate the entire task force. I expect that the public, using the things that you're doing today, for example, or we're using today, using Zoom, we want to have public forums in each of these areas to hear what the community wants to say, to listen to them carefully, and then to develop recommendations. And this is specifically how city government can pivot to support the changes that are needed as a result of this pandemic.
When you first described this to me just before we went on the air, you talked about this task force planning for the new normal. Well, that got my attention. How do you see the new normal?
Actually, I hope that the community and the residents will determine what the new normal is. For example, we all know that the hospitality industry, the professional services industries have had huge drop-offs as a result of this virus and the regulations that we put in place. So how do we help them connect together? What collaborations are needed for them to get back to whatever that new normal is? So what's going to change as a result of this? I don't know, but I expect that there are a number of people that are having a lot more direct experience and have ideas that we need to begin to discuss. And so that's what we're going to listen to, how the people feel like they are navigating this change. That's the most important thing. I would hope that our efforts would mean that everyone in this community has a chance to comment and suggest efforts. I don't know if you were aware, but Tart Bakari and Tracy Dodson conducted a Zoom meeting with over 400 people, 100 speakers and 400 people in the small business community. And at the time, we had already started talking about the restaurant industry and the hotel industry, but we would have never really thought about the number of artists that act as independent contractors, the videographers, the people that do a lot of the professional consulting work that we have for any industry, our marketing and media people. Those are kind of folks we wouldn't have known about what they're experiencing. And they have had a tremendous hit, just like the hospitality industry.
This community recovery task force, I believe you told me, will have its first meeting, or its targeted first meeting is for April the 21st. Chief Robert Graham is with us. He runs the Mecklenburg County Emergency Management System. I don't remember the date that we are anticipated, Chief, to have the peak of COVID-19 cases in Mecklenburg County. Is it before or after April 21st, or do you know?
So I think there's a lot of data out there, and the modeling is all over the place. So there's a model out of Washington, there's models that the state uses, and there's models that are run locally through Novant and Atrium health systems that assist us. And when we look at those models, some of them look specifically at Mecklenburg County, and some look at the region. There is a date that was put out there, I believe it was April 18th, but that changes every 3 days. What the hospitals are looking at is somewhere between mid-April and mid-May, but it's important that we don't focus on that, because we don't know. What we do not know is what will happen when we lift our stay-at-home order, and there is, of course, concern of a second wave throughout the country. So currently the stay-at-home order is through April 16th, but we are looking at extending it to match what the state is doing, and the state is looking also at possibly extending their order. So we think that that with the initial stay-at-home order, we're able to get the curve down by 30%, and that is helping tremendously. But we still have tremendous challenges in our own community as we look at bed space, but then also the big question is ventilators and staffing.
You, as the head of emergency management, you activated the Emergency Operations Center, something you only open when conditions warranted. What triggered it opening this time? When did you understand, and when did other Charlotte officials who look out for the health and welfare of Charlotteans and Mecklenburg County residents, when did you recognize this as being something that qualified for emergency management?
Yeah, so that's a good question, and let me clarify for everybody just to lay it out there. So my job, I'm the deputy director. I run the day-to-day operations, and I'm supported by Deputy Chief Bonham of the Charlotte Fire Department, who's actually the director. She's got 7 divisions underneath her, and then the fire chief, who's the chief executive of emergency management, and then of course our city and county managers. But day-to-day, yes, I do have the wonderful opportunity and huge responsibility of running emergency management. So Gibby Harris, our health director, and if you think of emergency management, of course, everybody's kind of talking about it, like, what is this emergency management thing? It happens all the time. And a lot of times we're not in the forefront because, we're not out actively riding fire trucks or, police cars or ambulances, but we coordinate everybody all the time. And we are emergency management for the entire county, which means we have, of course, our 7 municipalities and then the county government. And during this time, we spent a lot of time on the 11th and 15th floors of our government center. Gibby Harris is our health director, and she's my battle buddy. She sits right next to me in the Emergency Operations Center, and we probably talk 10 or 12 times a day when we're not together, or I'm not driving her around to meetings and working through this. We started tracking this, I think, back in December. And in late January, we were lucky enough to be chosen by FEMA at the direction of Mayor Lyles. She wrote the letter and asked for a course to be held here in Charlotte. It's called the Integrated Emergency Management Course. And it's a capstone course for FEMA. And so we had all of our city and county leadership down at the Fire Academy for 4 days to go through scenarios just like we're going through today. And we plan for all hazards. So it doesn't really matter what the disaster is. We're focused on how we're going to handle that and what the process is for that. Gibby called.
So Mike, can I say something about this? I think that this is going to be one of those things that you'll be able to ask everybody in the city, what date do you remember the coronavirus? And mine was on March the 9th. I know that our EOC began to work very quickly right after that date. And I can't say enough about the collaboration between the city and the county. And now the collaboration that we have with our utilities, with almost any agency that serves our community. That's what you're seeing at the EOC. It's not just law enforcement and fire and but think about how we make sure our streets are clear, that our garbage is picked up, how our utilities are working with us. So it's hundreds of people out there.
So let me update us as to where we are right now this morning. There are, as I understand it, as of yesterday afternoon at least, it was reported that a total of 810 coronavirus cases in Mecklenburg County. 69 new cases were added yesterday. That's an increase of 11% more than the day before. And health officials say that the number was likely only a snapshot of the true burden of COVID-19 here. That means the real number is probably a lot higher. And we know that because there's not a lot of testing going on here or elsewhere in the country. Are we conducting testing at any significant level, Mayor Lyles?
I'm going to let Chief Graham address that because I think that all of us have been watching the national news, and we know that that most people don't show symptoms of the virus, and you can have the virus, which is why
we
people are
need
now
testing.
we need testing, and we also need to wear our face masks. But I want to say one other thing. We have over 800 cases, but may I pass along our city's sympathy to the families of those that we've lost. We've had 8 people that have lost their lives to this virus. And I just want people to understand that we are feeling this so deeply that at some point, when we look back on this and examine it, I think that we have to have a memory of those families that lost people, as well as those folks that have struggled to recover from this awful virus because of the need for ventilators, additional testing, for personal protection equipment. I just I don't know how this country is going to manage if we don't begin to look at pandemics in a way that's coordinated and not localized by either state or cities, but it needs to be a national effort so that every citizen of this country feels like they can be protected in a public health crisis.
Well, you're on the White House task force. I don't know which one it is, but you're on a White House task force. And President Trump has said, this is not my problem. This is the problem of state governors. So have you talked to him about this, your opinion on this? Because you're diametrically opposed to what he says.
I want to say this about my participation. Our task force is not met. This pandemic is everything that we need to all as elected officials pay attention. So that's what I've been doing. I've been at home. I have been practicing social distancing, but I've been in the office most days of every week that we have since early March. And I would say to you that Governor Cooper is our representative, and he has been calm and he has been pushing very hard. Again, I meet with mayors across the country. I've met with the metro mayors, but the governor is our spokesperson.
Mayor Vi Lyles is with us, also with us Chief Robert Graham. We're going to come back and get an answer to the question about testing. How many tests are being conducted in Mecklenburg County, and many other topics this morning on Charlotte Talks. Support for Charlotte Talks comes from WFAE members and Henderson Properties, a full-service real estate investment company serving the Charlotte region for 30 years. From purchase negotiations to renovations and managing the rental, Henderson is committed to their rental owners. InvestHP.com. And Southminster, featuring custom-appointed cottages and apartments, and the new Southminster Terraces, providing a full continuum of care in the heart of South Charlotte. Southminster, life with purpose. Info at southminster.org. The sudden and soaring rise of unemployment, the topic of this program tomorrow. 10 million Americans are out of a job thanks to the COVID-19 pandemic. Shutting down business lowers the curve, which is crucial to lowering the death toll, but millions have no jobs, no income, some for the first time in their lives. So how do you apply for unemployment? How quickly do checks go out? We explore this new era of unemployment and how to navigate the system tomorrow on this program at 9.
In these uncertain times, can you feel good if you know you don't look good? The salons are shut. The sign on the barber's door says closed, and doing it yourself is really only for the brave. It's not a top pandemic priority, but without a professional to turn to, how do you care for your hair? Hair do's and don'ts next time on 1A.
1A from 10 to noon after Charlotte Talks on 90.7 WFAE, Charlotte's NPR news source.
It's Charlotte Talks on listener-funded 90.7 WFAE and 90.3 WFHE. I'm Mike Collins. We're talking to Mayor Vi Lyles, our monthly get-together, and Chief Robert Graham has joined us this time. He's Mecklenburg County's emergency management. I mentioned that there are 810 coronavirus cases in Mecklenburg County, 69 new cases added yesterday. We don't really have a clear snapshot. This is a snapshot. We don't really have a clear picture of how many cases we have. And that's because not a lot of testing is being done here or anywhere else. Chief, how many tests have we conducted? Can we get our hands on tests? Would we like to do more testing?
Yes, we would like to do more testing, and that kind of falls to the health department, but I've spent so much time with them, I can answer that question. The problem with testing is you might have symptoms and not test positive, and then tomorrow if we were to retest you, you would test negative. So there's a little bit of a misconception out in the community that if we test everybody, that we'll know all the cases in the community at one time, and that unfortunately is simply not the case. The problem that we're seeing in the community is not necessarily the amount of test kits that we have, it's the capacity to run those tests. So they are getting better at the amount of time it takes to run the tests. But as of today, of course, we know, and you hit the nail on the head, with 810 cases from last night. I have not gotten the updated numbers for today. There is speculation, and data kind of points to this, but it's not hard and fast. Everybody's looking at things, that the number could be 5 times as high as that. And so that gets into the mortality rate, because as we know, this morning we hit 400,000 in the nation, and there were over 12,000 that had passed away. I do want to hit something that the mayor said. The 8 deaths that were reported as of last evening, the folks in the Emergency Operations Center, and there are many of them, and they do their best to practice social distancing, but they're working very hard. They all take it personally. And so each death is marked, and we actually discuss who that person was, as much information as we have about them, and try to track what caused that death and see where we are, and try to move forward from there. But it is a challenge, and it's going to be a challenge for our community.
And 1 out of every 4 cases in North Carolina is in Mecklenburg County, and the city of Charlotte is most of Mecklenburg County. There are the other towns, but we are the big kahuna. So do we understand why we have 25% of the cases in this state? Do we understand why?
I think
Population density.
Population density.
The size of our population, when you think about Mecklenburg County, over 1 million people, and the state's at 10.5 million. And you think about the density that we have in our city as we have grown, I think that's an indicator for us.
Does it concern you that some people are now saying that once this is over, the new normal will be people moving away from population centers, because we won't know for the longest time who has it, who doesn't have it, who's immune to it, who's likely to get it, and there won't be any vaccine for a long time, so that people will be reluctant to move to or be part of urban areas. Does that concern you at all?
I'd like to answer that one.
Sure.
I get very weary about, and you see it all the time. You listen to media. People talk about the new normal, or what it's going to be like in 2 years or 5 years, or whatever the case may be. And I think we have to be very careful of that, because, and we see this during large hurricanes, it does take, I'll say it takes a long time to recover from natural disasters, and that's primarily our focus. But this is a national disaster, and so I'm not going to buy into that. I think the new normal, there's going to be a number of things that the mayor, she talked about some of them this morning, we call long-term recovery. And we will get through this as a community. And I said it was a beautiful day in Charlotte, North Carolina, because it is. Okay. And I think that people at this point, if you remember a month ago, it was doom and gloom, and what are we going to do? This is the worst thing ever. We're going to get through this, and we're going to have a brighter day, and we're going to succeed as a community. And there's a lot to be done, but I get very, very concerned with people. You got to remember, some people are just on there to talk because that's what they do, and there's money to be made, and they want to get everybody riled up. And I think we're going to roll through this and have a brighter day.
So we have this statewide stay-at-home order in effect till April 30th, and public health projections indicate that if that order is lifted at that time, there is a 50% probability that hospital acute and ICU bed capacity will be outstripped. I don't know if that's the case in Charlotte, in Mecklenburg County, but if that's true, should those stay-at-home dates be moved forward into May, maybe June? What do you
Before
think?
Chief Graham addresses the specifics for what the healthcare systems are working with the public health director and the EOC about, I want to say that one of the outcomes that has made us so resilient and responsive has been the idea of how we collaborate around decision making. Every morning since early March, there has been a policy group that includes the healthcare system leaders, along with every manager of the cities and towns and the county. And they sit down and they talk about this efforts. And the results that you're seeing is because there is no label on anybody. Nobody walks in and says, I've got to represent my town or my city. Everybody walks in and says, we're in this together and we're going to make decisions that everyone agrees upon. And that's what you're seeing. And Chief Graham, would you talk a little bit about how we're looking at the hospital bed situation today?
Yes, ma'am. So, and the mayor hit the nail. I'm excited because she knows a lot about what we're doing down there. But the policy group, the fire chief, the city and county managers, emergency management, the sheriff, CMS, they all meet every morning at 10 o'clock. In fact, they'll meet in 32 minutes, and Mr. Jones will be on there, and Ms. Diorio. And you can't tell a difference between the city of Charlotte and the county at this point. We're all working so closely together, and we have open discussion. And then the town and city the city manager, town managers, and the county manager are the ones that actually make decisions as far as the restrictions. But that process is vital, and it happens 7 days a week.
Okay.
The rest of go ahead.
So Chief, I think you asked about the hospital situation. The emergency plans allowed for us to look at a lot of governmental facilities, particularly they really did suggest places like our university campuses because those students have gone home. There's the infrastructure there. And so we had planned, or the hospital systems had asked for a 3,000 bed acute hospital preparation. And now with the flattening of the curve, thank you to every resident that's doing this, they believe that they can go down in a number for the number of beds. And they've actually asked for a location between the two hospital facilities. Everybody knows Atrium's kind of Moorhead Street, Novant's on Hawthorne for the main hospitals. And I think the policy group will be discussing today where they think that the best location, because this is about making sure the healthcare system can be responsive to our community.
So what you're saying is that the fact that UNC Charlotte volunteered space for excess hospital beds, should they be needed, the hospitals don't think they are going to need that much space, and they want to move whatever expanded space they might get to a more centralized location between the two hospitals in the uptown area. That's what you're saying.
I think let me clarify that. So at this time, we start off with 3,000 bed request, and emergency management is working hard to find them the space that they need. They backed that down to 600, and then last night at the county commissioners meeting, the CEO from Atrium said there may be additional beds that are needed, and he's absolutely right because we're continuing to look at the data. Emergency management, along with the Army Corps of Engineers, is currently evaluating a number of sites, and UNC Charlotte is still on the list and still may be a location. We don't want to take that off. But we are also looking at sites in uptown Charlotte, and we've reached out to our Central Piedmont Community College. We have probably a total of 11 sites that are either have been evaluated or are being evaluated. And so part of that discussion, there's 4 things that we have to find. We have to find the location. We have to have the funding, make sure that's squared away, and the state of North Carolina has been fantastic. FEMA has been fantastic. But then the 2 things that are going to be difficult for us, and this is where They're trying to do everything internally as much as possible and not have to reach outside for a field hospital. But the two things that are going to be the hardest for us are supplies, and that includes ventilators, and staffing. And so because this is a national emergency and we are under a national state of emergency, the staffing and the supplies have to be sourced locally. The federal government has depleted their resources at this point, although there's no more resources coming online. And they do have a strategy of moving resources from hotspot to hotspot. We're not at that point where we would warrant those supplies coming here yet. And then supplies, our manufacturing is working as hard as it possibly can. And then, of course, our staffing, which is vital to this. And so we're reaching out. I know the hospitals are reaching out to their retirees. Medic is reaching out to its retirees. We're working with other hospital systems. Because, Mike, when we open our field hospital, I want you to understand this, the field hospitals in North Carolina that will be open, whether it's Charlotte or Asheville or Greensboro, they become regional centers. They're not specific to Mecklenburg County. We're not going to turn people away when others are in need. And so we're working as hard and fast as we can, and we're hoping that we can come to a solution that meets everybody's needs. But that's where we are in that process.
So
Can
yesterday,
you see how proud we should be of our community? That kind of responsiveness and planning ahead is what's making the difference for our city.
one of the other things that's making a difference, evidently statewide, is social distancing. And there have been some reports that not everybody is taking it as seriously as we might like. And yesterday, the governor announced plans that he plans to issue an executive order forcing stores to enact social distancing measures, maybe limit the number of people who can be at a retail location or in a retail location at a given time. He wasn't terribly specific about what that order might contain. He's still seeking input. Have you spoken to the governor about what he's thinking?
I actually communicate with the governor on a regular basis, but my personal experience has been that I have seen our grocery stores evolve in their planning and implementation of protection for their folks, as well as what I would believe most people would call our home improvement stores. I have seen where the distancing is marked off, where they're limiting the number of people to go into a store at one given time. But I think the governor's role and job in this is to make what works a regulation for the entire state. So in Charlotte, I believe that we are seeing these changes and we are ahead of the game in this situation.
You told the Charlotte Business Journal's Eric Spanberg that the downturns in passenger traffic at the airport and on city transit is a sign that people are heeding the stay-at-home orders. But CAT's buses and trains are operating during this crisis at no charge. Riding is free. If you want to encourage people to stay home, why are you waiving the fares?
Well, there are a number of reasons for that. And I think the most important one is that we felt like if we could get people on the bus, especially our healthcare providers, people that work in the healthcare system or other essential businesses, and they could just get on the bus and walk to a seat. It's better for the protection plan for our riders and our bus drivers and our train operators. So what you'll see is the first few seats in a bus and on the train are marked off, and you don't have to stop. That takes out one human interaction on the fare system. And we felt like that that was more important for the health and the prevention than it was to collect the fares. And we still believe that.
Because there was some discussion not too long ago about making the buses free of charge, and we were told that that's not practical in Charlotte, Mecklenburg, and yet here we are doing it.
Well, Mac, there's a big difference between a pandemic and regular operations. The CATS bus system, and I've said this, they're funded with the half-cent sales tax. And that funding, of course, will be different than what we projected, but it's a loss that we ought to incur for the time that we're living in.
You said, I think that we're doing a pretty good job of social distancing and complying with the stay-at-home order. CMPD Chief Kerputney says his department has received 1,400 complaints from people about other people not heeding the order. And he mentioned the protesters at the Women's Clinic on Latrobe Drive. several of whom were arrested for refusing to disperse the other day. We've seen pictures on local TV news of people in the parks not practicing social distancing, people around the city playing basketball and volleyball, etc. And he has said that if this continues, additional measures will have to be taken. Is that time now?
I think I sent the chief at least 400 of those 1,400 because people constantly are saying this person's violating this order and I want to report it. And we're sending those to the chief. Chief Estes is taking care of the day-to-day enforcement of this. I would say if you're not taking this seriously, it's not about you. It is about our community, your neighbor, your parents, your grandparents. And so when we've had these situations occur, we first try to educate and tell people, but we have started doing citations. And when there is after you've done the education and the advocacy to obey the rules, if those rules are not obeyed, then you're going to see citations and you're going to see that take place.
Unemployment around the country stands at somewhere near 10 million. It's probably going to be a lot higher than that when we get the new numbers, but nearly 500,000 people have found themselves unemployed just in North Carolina, and lots of small business obviously have shut down. The topic of how the city can help these companies and their laid off or furloughed workers was part of a conversation at Monday's city council meeting. Mm-hmm. What can the city do?
Well, one of the things that we're first going to do is find out how we can help them. And there are two areas that I think we can do this. People, and I want to say thanks to Tart Bakari, who's on our council, and James Mitchell. We have a business advisory council that we have asked, what can we do? And I'm going to give you a simple one. We've asked the question, what city ordinances stand in the way of a small business recovery? And there was an example of that where our food truck industry has just not been able to be out and about because of the regulations. But if they came back, one of the things that we had when we were all like trying to figure out food trucks is we said you can't park your truck in a parking space. You have to do it on private property. And that was one of the things the Business Advisory Committee, which is led by D'Alva Glenn, who said, let's think about that. Could that ordinance change so that the food trucks could rebound? There are many examples of that. And I'm hoping that the public will continue to send in their ideas. What ordinances stand in the way of recovery for any person? On the town hall meeting that Mr. Bakari and Ms. Dotson ran, we heard a lot about marketing people that have always had a robust client list. Well, that client list is no longer there. Can we establish a website just like the CRVA has said, here are the restaurants that are open? Can we establish a website to say, here are professionals that do consulting in these areas, can you use them? Those are the small things that we can do right now, but I would expect that the biggest thing that's going to happen is the reliance on the recovery money that's coming from the federal government to Charlotte or through the state, that we have to figure out how we best use that money to get everybody back to where they can operate or find a new way of operating.
Lightning round when we come back. Lots of questions, lots of different topics that we'll get hopefully slightly shorter answers to, because I want to cover a lot of territory with Mayor Vi Lyles and Chief Robert Graham with Mecklenburg County Emergency Management at Charlotte Talks on WFAE. Support for Charlotte Talks comes from WFAE members and Francis Dawson of Homes of LKN, especially now. Homes of LKN realizes the importance of supporting professional journalism, serving real estate buyers and sellers in the Lake Norman area for 17 years. Details at homesoflkn.com. And Clickfold Plastics, committed to the safety and health of our community, supplying clear protective panels and sneeze guards to grocery stores and other industries serving the general public. Information at clickfold.com. Well, what about your hair? It might not be the first concern in this time of Corona, but when we face the fact that we're indoors and we have to socially distance, we can't go to salons or barbershops, what do we do about our hair? A lot of people are talking about this now, looking for advice online about cutting and braiding and coloring their own hair. How have Americans been taking care of their hair since salons have been closed? And how are barbers and stylists coping with the loss of business? That's the topic in 20 minutes at 10 o'clock on 1A, and we will continue our conversation with the mayor next.
Hello, this is Richard Lancaster. I'm a board member of WFAE. In times like these, it is so important to receive information that is factual, trustworthy, and reliable. WFAE has been an important community link to providing information and reporting on how to stay safe and stay well. Please consider providing a contribution of any amount to the station. Please call 704-549-9000 or donate online to WFAE.org. Thank you.
It's Charlotte Talks on WFAE and WFHE. I'm Mike Collins. Mayor Vi Lyles is with us along with Chief Robert Graham from Mecklenburg County Emergency Management. Was it City Manager Marcus Jones who suggested that the city could redeploy about $1 million of existing community development grant money to help small businesses in low to moderate income corridors? Was that his idea? And is that possible?
It is possible, but funding is federal funding for our community development areas, and our community development areas along our major corridors. And the city council asked the manager to develop opportunities that we could use and put in place to assist people. And so we are focused on that first million for businesses in our corridors. Particularly disadvantaged businesses, what I would call your the barbershops. You were just talking about hair and barbershops, beauty shops, stores that are specialty stores in certain neighborhoods. And so that's an area that we look at. And then we're also working on meeting the needs of our housing community. We've contributed $1 million to the over $15 million Charlotte Recovery Fund, and their first round of grants included over $800,000 for rental assistance for people that would need this immediately. And they will have their second round of grants coming out, I believe, on Thursday of this week. And we're going to begin to talk about that more and tell people where they can go for that assistance.
But there are businesses all over town. There are businesses in Ballantyne who are suffering. So if we take that $1 million and give it to the opportunity corridors, businesses in those corridors money, is there money left over from any other pot of money for those other businesses?
I think that there is not right now we have not identified a way, but I would expect that when you look at the two SBA funds, I know that the personal paycheck program, it's called PPP, which allows small businesses to borrow money so that they can continue to keep employees employed. The federal government put $350 billion in, and I think within a week, that fund was depleted. And last night I saw the Treasury Secretary say that he would be sending a request to Congress for another $250 billion. We need to figure out how to do this in a way, not only for the bankable small businesses, for the unbankable or people that work in different ways to finance their business. That's the gap that we have, and we're talking about how to do that now.
You also acknowledged during that virtual meeting on Monday night, you were asked about using hospitality money to help hotels and restaurants, all of which have been brutally hurt by closures and stay-at-home orders and more. And you said that those funds cannot be used as grants, but you also acknowledged that the hospitality industry is one of the key industries that we have to help in any effort to recover from all of this. And you were asked if the $110 million in tourism dollars that were earmarked allegedly for Major League Soccer was untouchable. And you said, quote, "That's probably not the first thing on top of our agenda for tourism dollars. When we look at the loss in our restaurant industry and our hospitality industry," you said, "we're going to be looking at that first and foremost." Are you saying that $110 million might be repurposed for this?
I sometimes am amazed at my own language. I think you're asking me what is the that I said. And when I was talking about that, I have been listening to our hotelers and our restaurant owners, as well as our own Visitors Authority, CRVA. And we've been saying, okay, how are we going to manage this recovery in this area? We've gone through this before. So what are the things that we learned about that? And what can we do to bring that forward? And what's different about this that we need to do? And I'm looking forward to the continuation of that conversation. We need to create this conversation early and begin to make plans, because recovery in that sector really depends on the health of our airport as well, our business travel, our tourism travel. So when we're talking about how do we use this money, it's really the foundation of how do we get that money back into our city's flow.
So I don't know that you answered my question. Are you telling me that the
So,
$110 million that we said we may or may not, because I don't think that meeting has ever been held, has it? About definitely devoting that money to the Major League Soccer enterprise?
well, what
Has
we
that?
agreed, what our agreement with Tepper Sports was that when they completed the plans for the Eastland area
Mhm.
and for the soccer stadium, that we would then talk about how that money could be used. So I see that money as an investment. If we can get Major League Soccer playing next year, that
Yeah.
is a way to increase tourism dollars coming into our city.
So I still don't think I got a clear answer. Is that money available to help recovery, or are you going to earmark that and keep it there for Major League Soccer? Because when they come online, that will add more money to the coffers that can then be used for the recovery. What are you saying?
I'm going to say this more efficiently. And I've said this repeatedly. When we go into this effort, everything is going to be on the table. I don't have an answer to that right now
Okay.
because we need to find the needs, we have to find the solutions, and there are no definitions around that right now. From our property tax, our sales tax, from our hospitality taxes, I'm saying that we would need to be thoughtful, we need to be responsive, and we need to be prudent for our future.
City Council also on Monday night discussed the economic relief for individuals coming from the stimulus bill that recently passed through Congress. And evidently, Charlotte is scheduled or expecting to get millions of dollars as a result, $3.9 million for a community development block grant. How will that money be used? Who will benefit from it?
Again, this money is what is called community block grant funds, and it's restricted to people that earn 80% or below of our area median income. Now, there are going to be needs for people that earn more than that, but the money that we're getting immediately is that money that's restricted to that 80% and below. And so, the way that we've looked at is how do we keep people in housing so that we can avoid some of the things that happened in 2008 and 2009. And those would be people making less than 80%, which I believe is around $55,000 a year. And so we're going to look at mortgage relief, and we're going to look at rental assistance. And I believe we have, in addition to the 3.575 million, we have 1.7 million that can be used to help support our homeless population. And we're working with our homeless shelter providers and the county to make sure that we are increasing the opportunities for people to have beds as a result of that money. So federal money that's restricted seems to be coming out faster than the money that you have to complete an application as an individual or an institution or an organization, even as government. So I think that that's because those formulas are in place and they're easy to recalculate and get money out. The other money, I don't believe that they actually, while they approved it, it may not have had the systems in place to get the applications in and determine what's being approved and to get it out quickly.
During your town, you held a virtual town hall meeting the other day on Twitter, I
Mhm.
believe, where I think about 7 people got to ask you questions in the course of the answer
We learned a lot
of
from
the
that
hour.
one. I tell you,
Did you?
Twitter is great, but we learned a lot because you ask the question, you answer it, and then you tweet it out. And I think every mayor in the country was tweeting out at the same time. So we're going to
Okay.
rethink that idea.
All right. Anyway, during that, you were asked about the Republican National Convention.
Mhm.
The president has been asked about this, and despite the Democrats postponing their Milwaukee convention and moving it now into August, a week before the convention the Republicans are scheduled to have here, the president insists, come hell or high water, the RNC will take place and go on as planned in Charlotte, even though the Democrats are talking about maybe they'll hold a virtual convention. You told the person who asked you on Twitter about this that we have a contractual obligation to host that convention. Won't health considerations trump those? No pun intended. Should it come to that?
Yes, they would.
Okay.
Oh, I'm sorry. I did. Yes. So let me go back. I have said, yes, we have a contractual obligation for that, for the convention. And we're proceeding to plan for that. I don't know what's going to be taking place in August. And I think the thing that I've learned about this is that decision making today can be different tomorrow. And you have to have your guiding principles to do this. And my guiding principle is health and wellness for our community. And so whatever we're operating under for the pandemic and the coronavirus, that's what we'll follow. So
You also
yes,
said the city still needs to take action to accept the $50 million security grant for the Republican National Convention, and that you're not sure when that will happen. Is that normal? I mean, what's the holdup? Is that our ace in the hole? Is that our out? Don't accept that. We can't have the convention. What's the holdup?
the holdup was basically that we're practicing what we've asked our residents to practice, social distancing, and we have to determine how to have virtual meetings. And so the holdup is really on us. The appropriation has been made. I think Minneapolis as well as Charlotte have to accept that grant, and we'll be looking at a time that we can do that.
A lot of questions have been coming in prior to this program and as we've been talking. So I'm going to let the listeners have a shot at this now. Allie on Facebook, why are there no steps taken to protect the homeless community of Charlotte? We have done a few things, right?
We have, when I say we, this is particularly the county community support services group. We have actually leased 3 hotels that we are beginning to house people in. And with the community development block grant money, the 1.7 that I referenced, we'll continue to implement strategies to get people into shelter. That's important for their own well-being, and it's also important because we know that homelessness is an issue, but during a pandemic, it can become a crisis.
Kristen on Facebook, commenting on people reporting on others not following the stay-at-home order, says, do we really want to live in a society where neighbors snitch on neighbors? It actually is pretty reminiscent of what we were taught about what happened in the Soviet Union. This is not a practice appropriate to a free society and should not be encouraged by a government official. You're not encouraging it, are you?
That's a difficult question because I don't know that we've ever had a situation where we could spread a disease silently and quietly. And when we have regulations, I've always said that I would hope every person in our community would respect those, and that we try to be open and clear and transparent about why they're there. But I think that there's sometimes people are concerned, and if we said this is the rule, it's like if this is the rule, you have to have consequences for the rule, especially when it results in a loss of life.
Chief Graham wants to get in on this answer. Go ahead, Chief.
Yeah. So I want to be, and this is where people start to go sideways. We got to get back to work, and I want us to get back to work. Everybody wants to put us back there. We will succeed or fail in this endeavor as a community. And whether it's government, the hospitals, or our society, we all have a role to play. And right now, we're asking society to stay home. And I've said it before, find a way to comply with that request and that order from our government, and don't find ways around it. And we continue to have outlier folks or finding ways around it. 311 is the avenue for if there's massive issues out there, but we're going to have to continue to ratchet down our restrictions, because right now we don't have the capacity in our healthcare system to handle this if it has a super sharp rise. And this morning, just as we were talking, our numbers did go up to 823, and we added an additional death to 9 now. And so I cannot stress enough how imperative it is that we as a society, as a community, come together and do everything we can to socially distance and stay at home during this time.
Thank you, Chief Graham.
Then let me go to a question you were asked on the Twitter that you never got a chance to answer, the Twitter meeting that you had. Why are so many businesses listed as essential? I mean, right now, car dealerships, vape shops, ABC stores, gun shops, hardware stores, landscapers, contractors, maid services are essential. They can come into your home, etc. Why? Should they be shut down?
So vape shops are not, and here was a problem. I said this the other day. The state's order is less restrictive than ours. And we've had businesses that are sending, there's a portal they can go to with the Department of Revenue, and they're getting letters back saying they can stay open. The vape shops, a lot of them would turn around and selling water and chips and saying they were essential service. And they had this letter. That does not mean that they comply with our order. But we need everybody to do their part, because Chief Putney does not have enough officers to run around Charlotte, Mecklenburg County and writing everybody tickets. But when we do get a significant complaint, they are addressing those.
Okay. The city has a big load to carry here, and so does the county, and every government at every level does, because if we're going to get back to normal and we're going to help people recover individually and businesses recover, a lot of help has to come from the government. A lot of help is right now coming from the government, but you got to have revenues in order to support the outflow. What do you see as the economic impact of the early shutdown of the NBA, the shutdown of perhaps, or at least the delay of minor league baseball here, maybe the delay of the NFL here, the closing of all the theaters, the shutting down of the Wells Fargo golf tournament, and all the revenues that come from conventions that have canceled and hotel rooms that have canceled, and the hotel motel tax, which has probably been very hit. What do you see as the economic downturn that you are facing right now in the city of Charlotte?
Right now, I think that you've mentioned every one of them. Our dedication of room taxes, rental car taxes, sales taxes, food and beverage taxes, they're going to just take a deep dive. And so we know that. I think that we also have to look at where we're going forward, because if people aren't working, then they need to pay other bills besides paying for additional taxes. So we're going to
What about property?
make it work.
And any
Our
idea
property
of cutting
taxes have
property
already
tax?
been, well, I think, as I said, everything's on the table.
Okay. Charlotte Mayor Vi Lyles, joined today by Chief Robert Graham with the Mecklenburg County Emergency Management. Thank you both. Stay away, socially distance, be safe. Thank you for joining us.
Thank you, Mike.
Charlotte
Thanks,
Talks with
Mike.
Mike Collins is a production of 90.7 WFAE. Support for Charlotte Talks comes from Mazda of South Charlotte. Wendy Herkey is the executive producer. The senior producer is Aaron Keever. Our producer is Chris Miller. Our assistant producer is Jesse Steinmetz. Jennifer Warsham is our production assistant, and our engineer is Joby Sprinkle. For more information about Charlotte Talks, go to WFAE.org/Charlotte Talks.
Things are quite